she, her. I'm delighted to be your moderator for this virtual program called Creating a Sustainable Future in Pharmacy. I'm the Associate Dean of Practice Innovation and Professor of Teaching at UBC Faculty of Pharmaceutical Sciences. For today's events, we are using Zoom's live captioning to ensure the event is accessible to most people. Please look at the bottom of your Zoom window for the Show Captions button, where you have the option to turn it on or off according to your preference. If at any point during the webinar you experience any audio or video issues, please reach out via the chat and a staff member will be in touch. I am privileged to work on UBC's Vancouver campus and respectfully acknowledge that it is situated on the traditional, ancestral, unceded territory of the Musqueam people. I'm calling in today from the city of Vancouver, the traditional lands of the Musqueam, Squamish, and Tsleil-Waututh peoples. We also want to acknowledge that UBC's Okanagan campus is situated on the traditional, ancestral, unceded territories of the Syilx Okanagan Nation. I would also like to recognize the many places near and far that you are all joining us from and acknowledge the traditional owners and caretakers of those lands. To learn more about the land on which you sit, I recommend the excellent resource nativeland.ca. By acknowledging the traditional owners of these lands, we are reminding ourselves that Canada's legacy of colonization continues and that we, as a university and settlers on this land, have an obligation to advance reconciliation and decolonization in this country. The UBC Respectful Environment Statement provides the guiding principles to support us in building a setting in which respect, civility, diversity, opportunity, and inclusion are valued. On behalf of the UBC Faculty of Pharmaceutical Sciences, I'd like to extend a warm welcome and thank you in advance for creating a respectful and inclusive environment for your fellow alumni, guests, and speakers. Forward, the campaign for UBC is the biggest fundraising and alumni engagement campaign in UBC's history. With the support of alumni, donors, and friends like all of us joining today, UBC is advancing healthy lives, a healthy planet, and healthy societies while addressing the immediate affordability needs of UBC students. Today's topic is representative of one of the many ways UBC is undertaking research to help create healthier lives. The Innovative Thinkers webinar series is part of the faculty's alumni programming, created to highlight our researchers, faculty, and alumni from the UBC Faculty of Pharmaceutical Sciences. The faculty's vision is to be a catalyst for change in pharmacy practice and the pharmaceutical sciences. Our goal as innovators in pharmacy education, research, and practice is to support the optimization of drug therapy in the pursuit of improved patient outcomes. And we are so thrilled to have you all with us here today for this third webinar in the Innovative Thinkers webinar series. In just a few moments, I'll introduce Dr. Karen Dowry and Rob Pemmett, who will begin with a short presentation. Following that, I'll start off the conversation by asking a few questions, and then I will address questions from all of you in our audience. I'd now like to introduce our fantastic speakers for today's conversation. Let's go ahead and have them join me on screen as I introduce them. Dr. Karen Dowry is a clinical pharmacotherapeutic and research specialist in internal medicine at Vancouver General Hospital and an associate professor partner appointment with the Faculty of Pharmaceutical Sciences at UBC. She graduated with her Bachelor of Science in Pharmacy from UBC, after which she completed a hospital pharmacy residency at St. Paul's Hospital. She later returned to UBC to complete a postgrad Doctor of Pharmacy. She's a longtime volunteer with the Canadian Society of Hospital Pharmacists at both the branch and national level, and received her fellow status with CSHP in 2019. In her current role as BC branch delegate, she co-leads CSHP's Sustainability Implementation Task Force. We also have Rob Pemmett, and he is a research and development pharmacist in primary care, a partnership between Northern Health and the Faculty of Pharmaceutical Sciences. He is also an associate professor partner appointment with the faculty. Rob works as a team-based primary care pharmacist and supports other pharmacists in primary care networks across the beautiful and vast geography of Northern BC. He is also a research and quality improvement co-lead for the Canadian Association of Pharmacy for the Environment. Please help me welcome Karen and Rob. To facilitate asking questions, we will use Slido, our online audience engagement platform. To enter your own question you'd like to ask our speakers, please go to slido.com, SLIDO.com. You can use our event code, PharmSci, to sign in, and there you can submit your own question and vote up other questions you'd like to see answered. So for now, I will turn it over to Karen and Rob for their presentation.
Thank you, Terry, for that introduction. I'd like to thank Alumni UBC and the faculty for inviting me here tonight to speak to you about some of the work I've been doing in the area of sustainability. So climate change has been identified as one of the biggest global health threats in this century. And if we think back to this past few years here in British Columbia, we've seen firsthand the effects of climate change with the floods and forest fires. And these events not only have an effect on patients' health, but also can disrupt the delivery of healthcare services. So the healthcare sector is actually one of the major contributors to greenhouse gases. Canada has one of the most intensive healthcare sectors in the world, ranked as second. In Canada itself, about 4.6% of Canada's total greenhouse gas emissions can be attributed to pharmacy. Medications are estimated to contribute about 25% of the carbon footprint of healthcare in Canada. And surprisingly, this stat always, I find, kind of shocks people that the global emissions from the pharmaceutical industry is actually greater than the emissions from the automotive industry. So, knowing what a significant impact that pharmacy has on the environment has led me to a number of different research paths and also some advocacy work. And so my plan in the short time that we have together tonight is to touch on some of the work that I've done this past year or two. The first study that I want to talk about is this one, which was a residency research project. And I'd like to acknowledge the excellent work that my LMPS resident, Madison Lai, did with this project this past year. And so this was looking at how British Columbians view medication, environmental sustainability, and how all that affects their decision-making around medications. So we disseminated a survey across the province and had a variety of different questions evaluating their environmental risk perception, willingness for policy changes, and then we also presented them with different scenarios. And these scenarios were related to medication choice, with medication one being higher efficacy, but also higher environmental harm, and medication two having lower efficacy and consequently lower environmental harm. In addition to presenting them with these different medication options, we also gave them different scenarios. And some of these scenarios had higher stakes. So you can see here on the left side, there was a cold scenario, there was a stroke scenario, and an asthma scenario. And we were interested to see the effect of patients' choice on how serious they perceived the condition to be. And what we found was that for the cold scenario, the participants were willing to choose medication two, which had lower efficacy and lower environmental harm. However, for the stroke scenario, which we believe the participants perceived to be of a higher possible impact to health, they decided to choose medication one, which had a higher efficacy and a higher environmental harm. The asthma scenario was interesting, and this may be due to people's differing perceptions of asthma or whether or not they had any exposure to the disease. But interestingly, like the cold scenario, patients or participants also chose the medication two, which was the lower efficacy, lower environmental harm. We kind of switched things up with the asthma scenario and also presented them with a new inhaler that was as effective as their current inhaler, but more environmentally friendly, and asked them whether or not they would choose it based on cost. We found that 97% would choose it if it was less expensive, but there was hesitation in our participants in choosing it if it was more expensive. And these are just a snapshot of all the data that we collected, but I thought quite interesting to us and in our conversation here tonight, looking at how patients perceive and make medication decisions based on environmental risk. We had an opportunity for participants to answer a number of open-ended questions. And when we analyzed this, these were some of the bigger themes that came out from those responses. One of the major takeaways we found was in the participants to our survey was that they, acknowledged the environmental, risk associated with medications. However, they didn't feel that the burden of the expense related to choosing more environmentally sustainable medications should rely just within them. They thought that there should be regulation and pressure on manufacturers to take into account the environmental impact when they're developing medications and to report that to the public. I think one of the takeaways from that study is that, patients are interested in learning more about the environmental impact of medications and having that included in their decision making. One of my other roles within the faculty is in teaching. I'm the respirology module lead for the E2P program. And so a lot of what I teach is related to asthma and COPD. So looking at kind of how patients viewed, medication choices, I was quite interested to learn more and see what is being done across Canada in terms of teaching students. And this is a project that Rob and I both worked on. So this was an environmental scan of what currently is being done across Canada in pharmacy, Canadian pharmacy curriculums. So this, again, was a survey-based study, and we looked at trying to capture what their current inclusion was of sustainability topics in a pharmacy curriculum. We also had some questions related to perspectives and attitudes related to the topics themselves and transformation of the curriculum. So we had pretty good representation across Canada. We had only one faculty that didn't end up submitting a response. What we found overall was about a third of the respondents were including some type of topics promoting sustainable healthcare in their curriculum. Another piece that was quite interesting in what we found was that there was a lot of support for including environmental impacts of medications and sustainable healthcare topics in the curriculum. You can see here, these are the different statements on the left-hand side that we asked respondents to rate in terms of their level of agreement. So for the most part, there was a lot of support for working collaboratively and having these topics included. But there was this other piece where a lot of the participants felt that they didn't have neither the resources or expertise to include these topics in their courses. And so that has led to some other work that I'm going to speak to in a couple moments. One of the other pieces that I've looked at this past year was not only what's being done across Canada, but also what our students are learning when they come into our program and how much exposure they're getting to these topics within our curriculum. So this was a study done did at the beginning of the academic year, looking at students' perspectives on the integration of environmental sustainability and climate change topics in our E2P program at UBC. On the left-hand side, I've given you a snapshot of some of the statements that we asked the students to rate. You can see here, and this is surprising really in terms of, thinking about kind of our students are, a younger demographic, very, I think, much more aware of some of the effects and impacts of climate change. And so there was a lot of interest around this topic that was shown from the respondents. And you can see here, this is strongly agree and agree. And for the most part, students were interested in the topic and plan to seek out to learn more about it. When we look at how much kind of prior knowledge that they have on these topics coming in, we kind of see the flip side, that they really are coming into our program with fairly minimal, I would say, knowledge. You can see here, this is like no knowledge to minimal knowledge to moderate. So we don't really see that kind of, higher level of rating. So what kind of those pieces has led to is we're fortunate enough to get funding from the Students as Partners Fund at UBC to support the creation of some educational content. And this content is going to be, it is open access. We have it available on a wiki page that the link to it will be shared with you at the end of this presentation. So this is just a screenshot of one of the videos that we've created. I would encourage you, if you want to learn more about the topic or you're looking for resources to share with other people, these are very focused on pharmacy, and I think are very easily digestible. They're quite short, about 7 to 10 minutes. There's one on the background around pharmaceuticals and the environment. And then there's this video that's looking specifically at inhalers and their impact on the environment and climate change. And that work will be incorporated in our respirology module this coming September. So hopefully starting to build those blocks and add in those pieces to try to build up students' knowledge so that when they go out there in practice, if they're asked, questions from patients, they can answer it, very knowledgeably. One of the other things I mentioned at the beginning, and Terry mentioned in my bio, is I'm the co-lead with the Canadian Society of Hospital Pharmacists Sustainability Task Force. And so this work has been the last few years, and we've made a number of recommendations for the organization to take. But one of the things I wanted to mention today that I think would be most useful to all of you is this work we have done with Cascades. So Cascades is a national organization that has put out a number of playbooks and has a number of resources available on their website. I think this one is one of the earlier ones that they did and that we worked on with them. And it's looking at climate resilient, low carbon, sustainable pharmacy. So a question I often get asked is, what can I do? Like, what should I do? And I think this particular playbook I find really lays out nicely what you can do. And it varies too. If you're a staff pharmacist in a pharmacy setting, what you can do. Perhaps if you have a role as a manager or more on the operation side of things, actions that you can take. And it breaks it down here. You can see in terms of medication optimization, sustainable operations, and then a piece around education. And I really feel like a lot of these medication optimization pieces are things that we as pharmacists do in our practice, making sure patients are on the right medication for their conditions. And, that is rational use of medications helps contribute to a more sustainable pharmacy. And then there's a variety of different things that can be done at the operational level too. That's nicely outlined in this handbook. And also Rob is going to make mention of some more of those in his section. So I'm going to turn it over to Rob.
Thanks so much, Karen, and to the Alumni Office for asking us to present this content to you and engage in a bit of a discussion. I want to touch on a couple of things that Karen has mentioned, but maybe in a little bit more detail. And as we get into the summer of BC, I really think about these two, the yellow and the darker blue section within this climate effects on our health in Canada. And so, in Ontario and Quebec right now, they're undergoing a heat dome or something that's similar to the heat dome that we experienced in BC a couple of years ago. And there's a lot of potential issues for people, especially in urban centers where they maybe aren't able to escape the heat as easily, but also for people in rural and remote centers where they just don't have access to things like air conditioning and they maybe can't cool down. So there's a lot of potential issues with heat related stress to our communities and also to air pollution as we come into these seemingly every year high risk wildfire seasons for us. And I live in northern BC in Prince George, and I don't think I'm gonna have a summer going forward where I'm not really thinking about the wildfire risk and can never put that out of my mind. Whereas 10 years ago, it was something that seemed to happen, every once in a while, but now it seems to be just a constant summer issue for us. So there's a lot of impacts of climate change on our health. And as pharmacists, because we have a pretty substantial impact through, stewardship of medications, we have a big impact we can potentially make on mitigating this. Within this role of pharmacy, I think about three big buckets of work. One is mitigation, one is adaptation, and one is waste management. And so mitigation is how do we, decrease the effects of our work and our profession on climate change. Adaptation speaks to our ability to accept that the world is changing and the climate is heating up, and how do we respond to that? And finally, that last bucket is the waste management, because there's a lot of potential issues, both with plastics and from the chemical effluent that gets into our land or into our water if it's not disposed of properly. I read about this story about a month ago, and very sad story about a 9-year-old boy who died of an asthma attack, which the parents believe were exacerbated by wildfires. So I don't want things like this to happen. I don't think anyone wants things like this to happen, and I feel it's our responsibility as pharmacists to be able to contribute to improving these kinds of scenarios. And so as a pharmacist, can we think about educating our patients to be more mindful of poor air quality, to educate them about how to, maybe rely on their rescue inhalers a little bit more during these kinds of wildfire seasons where things could potentially go worse for them. And then what's our overall responsibility to mitigate some of the effects of our industry and our profession that contribute to the increasing presence or prevalence of wildfires. Waste reduction is another huge thing. We use a lot of plastic in our day-to-day work lives. Less than 10% of plastic produced has ever been recycled. Most of it goes into the ocean or to landfills, where it decays extremely slowly. And if it does decay, it contributes to greenhouse gases in that way as well. So it's sort of a no-win situation. But you all know that we use a ton of plastic in dispensing medications, either stock bottles, patient vials, things like unit dose packaging, and then the devices tend to contain a lot of plastic as well. So I really want us to be mindful about ways we can potentially reduce waste, and recycling is an important part of this story, but it's maybe the least important part. And I think about that sort of grade school reduce, reuse, recycle. We should really go think about reducing and then reusing where we can in things like institutional settings. Many of you will be familiar with this NISA acronym that we use in pharmacy school, and I'm wondering if, as part of our changes in the curriculum, that we really need to add an extra section here and think about the planetary impacts during our entire thought process. So that's something that I've been musing over for the past couple of years and bringing both to our faculty and to other schools across Canada. Thinking about a couple of practical actions that we can do. Things like pill splitting can be potentially beneficial. It can reduce plastics used in logistics and transportation and packaging. It could also potentially be beneficial for your pharmacy workplaces by reducing inventory or reducing the number of SKUs you can do if it's reasonable to do so. Deprescribing, I think, is a really impactful thing, stopping those low value or no value medications and stopping meds that are no longer indicated can be super important to tackling all three of those buckets of work for pharmacy. And then, of course, refusing medications with no or low clinical value. So I'm thinking back to Karen's patient survey that she did, where those people with colds who, if they knew the true cost, the environmental cost of some of these medications, maybe they would choose not to use them when, if they were prescribed a salbutamol inhaler to help their breathing during a cold, but the breathing really wasn't that bad, and there's no good evidence suggesting that that would be helpful. I think that we can really, really reduce that. In the hospital setting, stepping down to oral medications can be really helpful in cutting down some of the plastic waste and all of the back end greenhouse gases and energy that's used to sterilize and create IV medications. Educating our patients about proper medication disposal, bringing them back to the pharmacies so they can be put into the proper waste management stream. And then general plastic reduction, I think, is really important. So, pretty easy stuff like not using disposable gloves when standard hand hygiene practices are safe and effective. Ordering larger stock bottles of medications if that's appropriate, if you can use those in your settings and not have medications expire, can also cut down on a lot of plastic waste and logistical energy. The last thing that I want to just briefly touch on is this recently produced WHO toolkit that really teaches all kinds of healthcare professionals to communicate appropriately about climate change. The executive summary, in 2 sentences, does a great job summing things up. Health professionals are well placed to play a unique role in helping communities to understand climate change, protect themselves, and realize the health benefits of climate solutions. So I know many of you may think that you don't have enough information to be an effective communicator about climate change, but really the benefits of starting to talk about this are huge, and we can see things like improved air quality, improved physical activity and health in our populations that we serve, improved mental health, and reduced effects of urban heat. So there's a lot of talking points in here. If you can understand these 5 points that the Earth is warming, it's us, we're sure. It's bad for our health, and there are ways to fix it. You've got enough information in your toolkit to be able to speak intelligently to patients about the health effects of climate change. There's a couple of great messages in here, sample messaging to patients about climate change, and so I encourage you to have a look at the whole document. It is like 30 pages, but it's very well spaced out, so it's a very rapid read, and I encourage you to take a look at it. The last thing I want to mention before we go back to take some questions is just surrounding pharmacy education. So Karen mentioned that we're starting to look into this as an integral component of our curriculum, both at UBC and elsewhere in the country. And the students are really, I think, passionate about this. They've got the most to lose and also the most to gain by learning and making improvements in their future profession here. So we've got some momentum to start integrating this content into our teachings locally and across the other schools in Canada. And I think we really want to capitalize this. So I don't think you should be surprised if in the coming years you have students who are with you on practicum asking lots of questions about the potential planetary health impacts of the decisions that are being made on your sites, the clinical decisions and the logistical decisions that are being made. So I hope you will look forward to having those conversations and to learning from the students as they bring some of these ideas forward.
Great. Thank you so much, Karen and Rob. That was an excellent introduction to the topic. And very timely given the current heat warnings down east, and we know wildfire season is just around the corner. As a quick reminder to our audience, don't forget to add your own questions to slido.com, and our event code is FarmSci to sign in. So we're going to start with some questions here, and Rob or Karen, either of you feel free to answer these questions. I'll start with, what practical steps can be taken to ensure that pharmacists are enabled and empowered to support environmental sustainability?
Well, I think the way Rob kind of finished things off there, I think he really highlighted some kind of key things that pharmacists can do to educate themselves. And I think we've provided different resources that if you don't feel you have kind of that background knowledge on the topic, there's a variety of different things either produced by us or available online from different organizations that pharmacists can use to support and build up their knowledge. I think an important thing I like to emphasize too is that a lot of the things that we already are doing support environmental sustainability with medications. So, looking at your patient's medications, doing a medication review, making sure that the medications that they're on are appropriate for the conditions, and taking away the ones that aren't. And making sure that patients aren't being prescribed medications where they don't have a clear indication. That salbutamol inhaler for the cold is typical one that I see in the hospital practice. I know happens in community. Trying to decrease those instances where medications are being inappropriately prescribed, where patients don't really have a condition. And I think too, educating patients that starting to educate patients on things too, like proper disposal of their medications. I think all those are kind of like little things that we can incorporate easily into what we already do, that would have a huge impact downstream.
Great. Thank you, Karen. So you and Rob have been doing this work for a while, and I'm just wondering if you've seen any positive benefits yet from doing this work, and what some of those might be, if you can both give us all some examples.
Maybe I'll start and just say that we were recently at a pharmacy education conference, and both Karen and myself were invited to speak about this topic in various sessions, and it was the biggest after talk response I've ever gotten from the audience. People being really engaged and interested in this kind of work. It's new for a lot of people. It's new for a lot of schools to be thinking about this. And I mean, even my journey, I've always been, what I would consider environmentally conscious, but I haven't really engaged in the pharmacy specific work up until about 2 years ago. So it's really new. It's exciting. People are talking about it, and I'm just very, I'm very happy to have that conversation and to see it start to come into our sphere a little bit.
Yeah, I would agree, especially in the clinical setting that I work in the hospital, and kind of tying in with the asthma COPD teaching that I do. We've known the impact of inhalers for a while, I would say, but I think only in the last few years, there's actually been some impetus to, address the impact of inhalers and actually make changes in practice. Before, when I would kind of talk about it, they're really, people are kind of like just brush it off and say we have other things or more important things to do. But now I've really seen a shift in everyone's focus and support for making these changes. It's something to, like, I work in a large tertiary site. This the we focus now on different medications recently, like anesthetic gases being one of them, addressing the concerns around that, and now moving on to inhalers and seeing what we can do in that site to improve their use, where I would say a few years ago, if you brought up the topic, you would get no traction. So I think that's a very positive direction.
Great, thank you. Speaking about inhalers, just one quick follow-up question on that from the audience is, we are expecting climate-friendly propeller inhalants. Do you know when they might be on the market in the next few years, or any idea on that?
Um, I I gave a talk in February where there were a number of pharmaceutical representatives present. It didn't seem like I had a good sense of when those would actually be marketed. There are kind of lower volume options if patients do need metered dose inhalers. Unfortunately, right now there's within those MDIs, there's only the Teva salbutamol is the only one that falls within that. And I believe there should be a low dose or low flow, I should say, ipratropium inhaler coming out from one of the other companies. But as to the larger changes, I'm haven't seen anything with a definite timeline. I don't know, Rob, if you know.
I haven't, yeah. I guess the only thing that comes to my mind is within the, the greener options, um, both soft mist inhalers and dry powder inhalers, if appropriate for your patients, both indication and, their inspiratory ability, are greener than MDIs in their current form. So where you do have opportunities to make adjustments for these reasons, I think you should take them.
Yeah, so the change really even in the guidelines from Ventolin to Symbicort and those sorts of things are helpful maybe. Building on that, are there resources to help us determine the environmental impact of specific medications besides inhalers?
Ooh, this is hard.
That's so hard. I was at a meeting yesterday where this came up and we discussed it. Um, and unfortunately, my understanding is that the amount of work it takes to actually map out the life cycle of medications and their environmental impact is actually quite intensive and quite costly. So there really isn't, but I know of kind of that general knowledge out there. Um, it was a task force meeting. We received funding to create a hospital specific playbook with cascades, and that was one of the things that we as a group wanted to do was showcase other medications and their life cycle because all the focus has been on anesthetic gases and on inhalers. But it's unfortunately, I don't think that information is readily accessible. Again, Rob, I don't know. You can correct me. Yeah.
No, I completely agree. There are very few published life cycle analysis out there. And I think this information is quite opaque. It's further complicated by the fact that it's not molecule specific. Like you can't just do a life cycle analysis for Ramipril because the way one manufacturer makes Ramipril may be slightly different than another. And so you might be able to get some approaches, but even changes, from tablet form to capsule form, depending on how, companies decide to produce stuff could affect their life cycle and their footprint. And so it would be an amazing thing to have, um, in the available to both regular clinicians and to regulators and Health Canada as they're approving medications to have some kind of idea of this, but unfortunately, it doesn't seem to be there yet.
Great, thank you. With innovator pharma companies creating climate-friendly propellants, should hospitals or others move from generics if they still use harmful propellants? Not an easy question to answer.
Lots of budgetary considerations, obviously, but I do think that P&T committees and medication use management folks should be considering the overall cost, which includes the environmental and planetary health cost in the any product that they're putting on a formulary. And I'd go so far as to say, like, should they be considering whether or not medications need to be refrigerated, and do we need to bring those in? Is that a cost consideration that's part of the conversation for P&T? And my hope is that it is.
Great, thank you. A question from our colleague at UBC, Faculty of Pharmaceutical Sciences, Vaughn. He has stated it's a known fact that medications, the expiry dates are very short. And are you aware of any movements to change regulations to extend these expiry dates and potentially prevent wastage?
I think there has been a lot of work around this area and kind of pressure to make that move, because we know that for example, like the EpiPens, when there was the shortage, the expiry date was extended out for those considerably. So we know that it can be done. Whether or not we'll see kind of that change at a higher level, I'm unsure, but I think a lot of people are very much so interested in looking at that.
Yeah, I'd agree. I think the biggest movement that I've seen in this in a long time was surrounding COVID vaccines and Paxlovid, and it's somewhat heartening to see that at least sometimes people are willing to do the work to really look into that beyond use dating and try to identify what is an actual expiry date or beyond use date for many of these products, especially when they're short. So I'm hoping that, again, we get more momentum and this starts to apply more broadly.
Yeah, looking at it from a safety point of view versus an efficacy point of view, right? I have two more questions. They both relate, again, to the pharmaceutical industry, so I'll sort of summarize them both. But just talking about, switching to more climate-friendly pharma companies, which you've already touched on, but also if you could comment on pharma industries onboarding to the Sustainable Markets Initiative, and Health Systems Task Force driving to a net zero carbon footprint. I read that word for word because I wasn't sure what those words meant. So if you can comment on that.
Do you want to go ahead, Rob?
Yeah, I'm just rereading the question.
Yeah, I don't
So
know where.
my background understanding, and again, there does not seem to be a lot of information about this out there available to to clinicians and scientists. But the few life cycle analysis that I've seen, they've actually identified that the biggest part of the footprint is in logistics and packaging. So from growing some plant to creating an API or chemically synthesizing the API, that is certainly a component of it. But in many of the life cycle analysis that I've looked at, it's the second half. Like as soon as it's packaged up in its final form and then shipped to a distribution hub and then a wholesaler and then to individual community pharmacies, that is the biggest thing. So I think the easiest way for us as clinicians to tackle that biggest chunk of the footprint is to just not use this stuff when it's not appropriate and be really embrace our role as medication stewards and do that hard part of having the conversation of like, is this appropriate? And if it's borderline, maybe shifting your stance to the side of the fence where, well, if it's borderline and you may not benefit, maybe you don't need it and we can just end this. Whereas, certainly I can appreciate how it's easier to slide the other way on the fence and just say, well, what's the harm? But we need to start considering this planetary health piece as a big harm that is difficult to see.
Great, thank you. I have learned a few things. My favorite is it's warming, it's us, we're sure. I take that away with me. And then I think what resonated with me was the role of pharmacists in deprescribing and making our patients aware of these issues. So we've wrapped up all the questions on Slido. I will ask, I think, one more question from my list, and I just want to know if you can, when you're looking ahead, what are some of your future plans or aspirations for continuing to expand this work?
Oh, I'm looking forward to actually the implementation of all that content that we created this fall and to kind of get the students' feedback on it. One of the great things too with that opportunity to present at the education conference last week was we were also able to kind of promote that material. And so definitely like I hope that other faculties make use of what we've put out there, because I know that can sometimes be the biggest hurdle is creation of content. So kind of hope that we'll get widespread uptake of what we have. And then research wise, I think there's a lot of opportunity to move forward more so in this area. One of the studies Rob and I have that will be upcoming is looking at, just pharmacist views on all this and kind of what barriers, facilitators they may see in incorporating it. So hopefully we'll kind of have that and be able to move it out to all of you and your colleagues sometime this summer.
Yeah, I'm also, really excited in the conversations that we were able to have last week at the educators conference, and I'm hoping that we can leverage the 11 schools of pharmacy that we have in Canada to co-develop some of this content and co-integrate it into our curricula, so that we don't all have to do it on our own, which is a lot of work, especially for for some of the smaller faculties where they may have identified that they lack that content matter expertise. So I think it's that's really exciting. Future directions, a lot of my colleagues I know are working on inhaler and respiratory based projects, which I think are high impact. I'm doing a project on some logistic related stuff, so I'm hoping to have some results by the end of the summer on some waste reduction plastic savings that we can get by doing really easy interventions, and hopefully putting out some infographics that can be really applicable to clinicians and to patients as well.
Great, thank you. But before we close, I would like to give you both a chance to provide a brief final thought for our audience. So if you can just provide one takeaway that you want our audience to leave with, and Karen, if you can answer first, and then we'll pass it over to Rob.
Yeah, I think the biggest takeaway is that you can have an impact, no matter what to what extent you take away what we are saying here. I think even just a little step of talking again, like talking to your patients about how to properly dispose of their medications, like including that in your counseling. I think if we all do that, like all those little pieces kind of add up to a larger impact. So just know that no matter what you do, all those little things do add up. And hopefully by starting to incorporate those types of things in your practice and encouraging your colleagues to do the same, we can kind of continue to move things forward in terms of our pharmacy practice.
Yeah, I think, a lot of these interventions are things that we're already doing in our regular practices as pharmacists. This is an extra incentive, and maybe the biggest extra incentive, to do some of these good pharmacy practices like deprescribing, patient education about waste, proper inventory management, and logistics type work. Like, these are all things that are part of our roles and have always been parts of our roles, but now we've got another kick in the backside to really get going on this.
Thank you. Thank you both, Karen and Rob, for leading us through an interesting conversation tonight. I want to thank everyone as well in the audience for joining us in this conversation today and for all the great questions you provided to us to lead this conversation. So just a reminder that this webinar series is created to support Forward, the campaign for UBC, which has a bold commitment to solve some of the world's most urgent problems by advancing healthy lives, creating solutions for the planets, and shaping thriving societies. And with that, on behalf of the UBC Faculty of Pharmaceutical Science, this brings our program to a close. Thank you again for joining us in this webinar in the Innovative Thinkers webinar series, and have a good night. And for those hockey fans, go Oilers, go.